on the pandemic, the challenges that it's brought, as well as some of the opportunities. But before I introduce our first speaker, Joey, if you can just flick on to the next slide, some familiar housekeeping notes, I'm sure. So unless you're speaking, please can you make sure that you have your camera off and that you are muted. There'll be an opportunity to ask questions at the end of the presentations where we'll invite you to turn on your camera and ask your question. The session will be recorded. It's recording now, so if anybody has any or doesn't want to be shown on the recording, please let us know. But we hope to share the recording and the slides after the webinar on the ISPAH website. Please also feel free to tweet throughout the session. So ISPAH and HEPA are both on Twitter and quite active on Twitter. So we'd invite you to tweet. And finally, please give us your feedback. So at the end of the webinar, there'll be a link to just give us a few bits of feedback on things that we can do in the future. Okay, so I'm very pleased to introduce our first speaker today is Dr. Kelly Mackenzie. Kelly studied medicine at the University of Leeds in the UK and graduated in 2007. After working for a few years in a clinical role, she undertook a master's in physical activity for health at Sheffield Hallam University in the UK, after which she chose to undertake a medical speciality training in public health. As part of her training, she completed a second master's in public health at the University of Sheffield. And then she opted to take some time out of her training after she was awarded an NIHR fellowship to undertake a PhD. Kelly's research interests around physical activity, particularly related to sedentary behaviour and undertaking pragmatic research, particularly researching the implementation of co-produced interventions to reduce workplace sedentary behaviour, which was also the focus of Kelly's PhD. She's recently successfully passed Survivor. Congratulations, Kelly, and has now returned to public health speciality training. So Kelly has 15 months left of her training, which she hopes to undertake a postdoctoral fellowship afterwards. So Kelly, looking forward to your presentation and hearing about your experience.
Thanks very much, Anna. Hello everyone. I'd just firstly like to say a really big thank you to ISPAH and to HEPA for the opportunity to share my experiences here today. What I'm going to talk about are some of the personal challenges that I faced whilst completing and submitting my PhD during the COVID-19 pandemic. And I also just wanted to highlight at the outset that I am going to touch upon some issues relating to mental health, particularly around stress and anxiety. So if this is a particularly sensitive area for you, please be mindful of that and do whatever you need to do to just be kind to yourself and take care of yourself. But essentially, I hope that by sharing my experiences, you find what I'm going to talk about really useful, given the current climate we all find ourselves in. And even if you're not doing a PhD or you're at a different stage of your research career, or you're not even involved in research, I'm hoping that you'll be able to resonate with parts of what I'm going to talk about today and what I'm going to share, because I think there are many sort of transferable challenges and learning points to take from my experiences. So I just want to start by providing a bit of an overview of what I'm going to talk about today. So firstly, I want to give a brief sum of my background, although Anna kindly included some of that in the intro, but I'll just briefly summarise it. So you can essentially see my experiences and get a bit of an understanding of my perspective. Secondly, I'm going to discuss some of the key challenges that I experienced and learning points that I took from these experiences in relation to returning to my PhD after a period of maternity leave, finishing my thesis and doing a Viva all during the COVID-19 pandemic. And then finally, I want to highlight what I did in order to try and adapt to this situation and hopefully provide some tips which you might find helpful as well. So just briefly summarise my background again. So as Anna said, I'm a medical doctor, currently specialising in public health. I opted to do a PhD fellowship with the NIHR, or National Institute for Health Research, which is a UK funding body. I started that in October 2016, and then 2 months before the end of my funding, I went on maternity leave. I timed that very well. And I was on maternity leave for about 10 months, and then returned to my fellowship, my PhD, in April last year, which coincided very nicely with the height of the first UK national lockdown as a result of COVID. So due to the COVID restrictions, and for me at the time, that was primarily relating to lack of childcare, I was delayed in completing my PhD. But my funding ran out, so I had to return to my public health training post, and I did that in August last year. But I was given the permission, essentially, to continue finishing my PhD thesis, even though I was back on the public health training programme, given that I was so close to the end. And I did eventually submit my thesis in November last year, and then, as Anna mentioned, I had my viva in February just gone, and thankfully passed that. So some of the key challenges and learning points that I experienced from both returning from maternity leave and the COVID-19 pandemic, both of these things brought huge challenges to completing a PhD. So firstly, returning from maternity leave. So I think returning to a PhD or any work for that matter after a period of maternity leave or time off is always going to be difficult. I had anticipated that juggling the requirements of work and study whilst also caring for my 10-month-old was going to be a challenge. So prior to going on maternity leave, I actually applied for some additional funding to just cover me for an extra couple of months. So that basically gave me a little bit more wiggle room to complete my PhD, because I just knew I'd need a little bit of time to sort of get back into the swing of things. I hadn't, however, anticipated a global pandemic. So the additional challenges that came due to the pandemic were, as I've mentioned previously, mainly relating to the lack of childcare and due to the lockdown restrictions that were linked to that. So in the UK, when I first came back from maternity leave, the restrictions were very much that childcare was only available for children of key workers, and there was no allowance for childcare bubbles or support from parents or close family or friends. Thankfully, that has since changed. So I was very lucky. My PhD supervisor was very, very supportive, very pragmatic, and advised me that effectively I was to think of myself as still on maternity leave, because I was still full-time caring for my daughter. However, this was easier said than done. I'm very much I suppose, a type A type of personality, and I did set myself some unrealistic expectations. And after a few months of unsuccessfully juggling work and caring for my daughter, I became increasingly stressed, more anxious, and it's built up until eventually it did bubble over. And I ended up having to take a period of sick leave to give myself some space and to get some support strategies in place and just to be kind to myself. Now, I found this actually really quite hard, because I've never taken sick leave before, and I very much think of myself as a coper. I just kind of get on with things. So it was a difficult thing for me to do, to take the sick leave, but it was absolutely the right thing for me to do at the time. And when I did come back to my thesis, admittedly, some of the issues around the childcare restrictions and things that had eased, but I did feel in a much stronger position for having taken some time away. So finishing a thesis during lockdown, some of you may have experienced this, some of you may be currently experiencing this. Some of you may have challenges associated with being maybe earlier in your PhD or other research for that matter. I was lucky in that I'd completed all my data collection, so I was just in the writing up phase, so I didn't have to deal with any issues relating to accessing participants. But having said that, if any of you that are listening right now, if you have had those experiences, it might be nice if you feel able to reflect on those in the chat, so others could maybe learn from your experiences of dealing with data collection during the lockdown. So I think for me, the greatest challenge I had finishing my thesis, aside from all the childcare issues, was making sure that my findings were still relevant, given that we were in this new world now. I'd completed my research in a pre-COVID world, had 10 months off, and then came back to a very different world. So my research actually involved developing and implementing interventions to reduce sedentary behaviour in workplaces. And given the extent to which working practices had changed since completing my data collection, it was possible that some or many of my findings and recommendations were actually no longer relevant. It also didn't feel appropriate to ignore COVID, given the impacts it's had on all of our lives and the associated changes to working practices and physical activity levels and sedentary behaviour levels. So what I ended up doing was I incorporated a section in the final chapter of my thesis to reflections on the potential implications of COVID on my research findings. And the information for this section was drawn from some emerging evidence that was coming out that had been published, some informal discussions with some of my key contacts in my participating organisations, as well as some of my own thoughts and reflections on some of the practical implications. And during my Viva, which I'm going to talk about in a bit more detail in a second, my examiners actually commented that this section was really useful and beneficial and really interesting as well. So I think it was an important thing to include. So doing a Viva during a lockdown is clearly a very different experience to a traditional Viva. It was held, mine was held online using our university virtual meeting platform, which is called Blackboard Collaborate. I hadn't actually used that platform before, so I was sent a test meeting to experience the platform prior to the actual Viva, which was really useful. And even though everyone I'd spoken to about Vivas had told me that you can never predict the length of a Viva, because it was online and because of the hardships of having to stare at a screen for hours and hours on end, I genuinely thought the examiners would want to keep it nice and short. I was very wrong. My Viva was 3 hours long, and I suppose that was definitely the biggest challenge for me for the Viva, just staring at a screen for 3 hours and the intensity that kind of came with that. And obviously there's an issue in terms of potential internet problems. I luckily didn't have any issues, but one of my examiners did, and that actually ended up delaying the start of the Viva, which, although was unavoidable, it did definitely contribute to me feeling a little bit more anxious beforehand, because there was that time where you're just ready to get going and you were a bit delayed. So that was a bit tricky, but my examiners were so positive, very tried to put me at ease, and overall I found the experience quite positive. So now for some practical tips for finishing a thesis during a pandemic, and these are very much based on my own personal experiences, so you may have different thoughts on this. But as I've previously mentioned, I think including some reflections or a summary on the emerging evidence relating to COVID in your research area is really helpful, and also thinking about some of the practical implications of the pandemic on your findings, and particularly your recommendations as well. I think having a couple of sections is very helpful. It can be really isolating finishing a PhD at the best of times. And this is obviously heightened during a pandemic where we're working from home. Many of us are working from home. So I think trying to schedule in some regular virtual or even walking meetings with your supervisors or colleagues or fellow students is really important. So you can talk about any challenges that you might be facing with people who are either in a similar position or been in a similar position. And now for some practical tips for doing a Viva during the pandemic. And again, these are very much based on my personal experiences. So I think checking you're familiar with the online platform is really helpful. And if you're not, asked to be sent a test meeting so you can try it out. Set up your space in advance, making it as comfortable as possible. Make sure the room's at a good temperature, your chair's at a good height and comfortable for you. Your desk space has everything you need, easily accessible, including a pen and a paper, a copy of your thesis, having a quick drink or snack to hand as well is very important. And feel able to ask for breaks. If you need a break and one hasn't been offered or suggested, then you can ask for one. And actually, I think having a break every hour at least is really important to sort of just give you that little break from the screen and give you a little boost of energy. And then the final point I just want to make on this slide relates to affirmations. And I use affirmations a lot, and I don't know if everyone will be familiar with them, but essentially they're a short phrase or statement that particularly resonates with you and that you can repeat over and over in your head. And for my Viva, I came up with the phrase, "I have the knowledge and ability to smash my Viva." But you need to find something that particularly speaks to you. But I also write them down and stick them in my workspace. And for the Viva, I mean, the beauty of it being online was I was able to do this, but I put it up on my wall so it was in my line of sight. So during the Viva, I could just flip my eyes up and have a little look, and it just gave me a little extra positive boost as well. So now I just want to talk about strategies to improve mental health and well-being. So again, this is based on my personal experiences. There are lots and lots of different strategies that you can find and that are available. But these were just a few things that I found really helpful. So firstly, counselling. So when I first went on to sick leave, I tapped into my university counselling service and was able to access 8 weeks of virtual counselling, and found it really helpful to have someone to talk to who's external to both my PhD and my family life. I was able to talk through some of my issues and thoughts and challenges, but also come up with some strategies to help me cope with some of those issues. And actually, one of the strategies I used was mindfulness. So I now do a daily guided mindfulness practice every morning, just 10 minutes. And I use the Calm app. And I find that this just gives me 10 minutes first thing in the morning of calm and me time before the inevitable craziness of the day begins. And starting my day off like that, I found has had lots of different positive benefits, but particularly including increasing my resilience, just making me feel a bit more grounded, and feeling like I'm doing something nice for myself as well. And obviously, you don't have to do this in the morning, you can just do it at any time that sort of fits in with your daily routine. And then including some exercise. I know I don't have to tell this audience the importance of doing some physical activity for your mental health, but often when we're stressed and anxious, it can just feel like another thing that you've got to do. But I have to say, for me, just taking a 30-minute walk around the block at lunchtime, whether it's just a bit of fresh air, getting my limbs moving, having a break from the screen, I find it really does help give me a boost and really helps my productivity in the afternoon as well. And then finally speaking with someone, so I spoke with my supervisor to sort of let her know what was happening. Spoke to a close friend so I could talk about maybe some of the personal things that were going on, and spoke to my GP, particularly in relation to sort of getting the sick notes, but she was also really supportive. And I think it is important to talk to people about how you're feeling, someone that you feel you can get some extra support from. And I just want to, the image that I put on this slide as well, I just want to highlight because I really love this image, and it's from an Instagram account that I follow called The Psychology Mum, and she basically, she describes it as she draws psychology, and she covers all sorts of issues that, way beyond just things relating to motherhood. But when I saw this one, it really resonated with me. And I know you won't be able to read all the writing on there, but that doesn't really matter. Essentially, what it's depicting is a cup, and the capacity of the cup signifies how much stuff we can deal with. And when our cup gets too full, it overflows, and that's when our mental health is negatively impacted. And I suppose for me, when I returned to my PhD from maternity leave at the start of the first UK lockdown, I think my capacity cup was actually already pretty full. So it didn't take much for me to reach my capacity and then overflow. The problem I had was that I hadn't recognised at the start how full my cup was. So it was a seemingly tiny thing in the end. It was just an email with one additional thing that I had to do. And it was that sort of tipped me over. And that really took me by surprise. So I think my main advice would be, relating to mental health and wellbeing, would be to try and think about how full your cup currently is, and proactively try and look after your capacity and think about what you can do to protect it when it's getting full. I suppose some of these strategies that I've just highlighted can, are ways that you can try and protect your capacity. So just final few thoughts really. Just want to say that, these times are really hard, and if you're struggling, please tap into some sort of support. I've popped a few examples on this slide. I've already talked about the Calm app. There's also Headspace, that's another similar app. I think both of those you have to have a subscription for, but you can also access free guided meditations or mindfulness practices on YouTube. You can also tap into university counselling or wellbeing services, speak to your GP or a friend or your supervisor. And there's also external organisations such as the Samaritans and other types of organisations that you can get extra support from as well. So I'm just hoping that by sharing my experiences and some of my strategies for managing these experiences with you, I've given you some ideas of things that you might find helpful to either finish your thesis, get through your Viva, or get on with whatever work it is that you're currently involved in during these strange times. And I just thought I'd share this final image of me and my daughter Iona, which I took immediately after passing my Viva, and you can see we're both very happy. But if anyone has any questions or thoughts or comments, please feel free to pop those in the chat, and we can explore those together later on. Thank you.
Thank you, Kelly. That was really great. Really interesting to hear. And I, for one, certainly appreciate that your kind of honesty and openness in terms of some of the challenges that you went through when you were going through that, but also the tips and suggestions, the practical tips and suggestions for how people can maybe seek help, and for anybody else that's going through the process as well at the moment. I think just checking with Joey, are we okay to have a question while we change over presenters?
Yeah, happy to have one question. And then if Kelly, if you want to stop sharing and Deborah can start sharing. Perfect.
Yeah.
So if anybody has a question for Kelly, please feel free to use the chat box to post your question. We will be having a Q&A session after Deborah's presentation. So maybe if people are just pondering on that one, I might jump in, Kelly, if that's all right, with a question for you. So
Yeah.
you know, I think we can appreciate, and I certainly felt this when I was doing my PhD, you mentioned about that, you know, it could be an isolating time for anybody. And I think one of the things that we've learned is the importance of staying connected whilst we're kind of socially distancing, socially isolated. And for a lot of PhDs, the opportunity to present and network at conferences and events in the lead up to the Viva is quite important in terms of being able to test the water, if you like, in terms of presenting your ideas and your research. And I just wondered how you kind of dealt with that, not having the opportunity to do so.
I suppose I just very much liaised with supervisory team to get their input, and also I think there's lots of support out there for anyone who is about to do a Viva. Anyone that's previously done a Viva is very, very willing to help and give advice, share advice. I think I mentioned that in my presentation that I've been told numerous times not to think about, you know, that you can't predict the duration, and that was from just lots of, I suppose, more informal chats with colleagues and friends who had done Vivas. I still didn't listen to them, of course, but but yeah. So I think I suppose for me it was a little bit different in that I didn't really have the time to even think about that anyway. So it didn't particularly didn't feel like an issue. But I did very much speak to colleagues, friends, and my supervisors to get input in terms of Viva preparation, mock Vivas, things like that.
Brilliant. It's certainly, yeah, sounds familiar. Thank you, Kelly. Okay, like to move on now to our second speaker, Dr. Deborah Salvo. Deborah is an assistant professor of public health at Brown School, Washington University in St. Louis. Deborah defines herself both as a physical activity and spatial epidemiologist, which I'm looking forward to hearing more about. And Deborah is committed to advancing this field of study globally, with particular emphasis on capacity building in Latin America and lower middle income countries. She's also served as an expert for the fields of physical activity and spatial epidemiology, the Fogarty International Centre, Robert Wood Johnson Foundation, World Health Organization, and others. And I'm delighted you can join us today, Deborah. Thank you. Looking forward to your presentation.
Thank you very much for having me, Anna, and thank you to ISPAH and HEPA for organizing this. I will start with an apology. I hope my dog is barking in the background, so one of the multiple COVID challenges, as you guys know. So hopefully he won't be too disruptive. During today's presentation, I will take a different focus than what we just heard from Kelly. Thank you, Kelly, for sharing your experience. I think it speaks to what a lot of us have gone through. I will talk a little bit more about, hopefully try to focus it on the opportunities in terms of potential research that we physical activity people can try to focus on and can try to make, you know, lemonades out of lemon. Okay. So this will probably be my only slide on challenges, and after that I'll try to switch gears and talk about potential research opportunities. And I would like to say that even if my talk will sound, I guess, a little bit more on the side of, you know, you can do it, you can go and find research opportunities, we can take this global challenge and make something positive out of things, I do want to acknowledge that this is not easy, and that the pandemic has brought real challenges to all of us to stay productive, to publish our work, to finish dissertations if you're in that stage of your career, to get grants. So I'm not trying to say that, oh, it's all very easy. This is actually all a big opportunity and we should just go out there and be very productive. I think it's very difficult and we need to take care of ourselves. And one thing that I'll share personally is last year, 2020, was the first year since I graduated from my PhD program where I did not publish a single first authored paper. And I took that really hard. I'm very harsh on myself professionally sometimes. And I'm, trying to sort of recover from what may seem in my CV as sort of a little bit of a rut. But I think hopefully everybody that assesses my progress and my job and just wherever understands that we were all going through difficult times. So in terms of our research as early career professionals or early career investigators, and I think Kelly touched a little bit on this towards the end of her presentation and questioning the relevance of her research, which I think it remains relevant and will be relevant again very shortly, hopefully, in the broad scope of our lives. Maybe there's a year or two where reality will change, but hopefully we will all emerge from this, and your research, Kelly, and other people that research things to do with workplaces and things like that will become relevant again. But nowadays it seems we're bombarded, we've spent a year being bombarded by grant opportunities for funding, calls for special issues in journals and things like that, everything focused on COVID. And not just on COVID, of course we can think of what happens with physical during COVID, but really focused on COVID, right? On trying to understand this virus and trying to develop vaccines for it. So we see like a lot of the funds available for any researcher, but definitely for early career researchers, be really geared in that direction of, oh, do you know how to develop a vaccine? We have a lot of money for you. Do you know how to study a virus? We have a lot of money for you. Do you know how to contain and mitigate transmission of COVID? We have a lot of money for you. And now, what's emerging is strategies for vaccine distribution. So, I've seen colleagues that work in physical activity and that work in other fields that have literally, for the time being, switched gears and tried to answer some of these questions. I think, whatever works for you and it both in terms of you doing the job that you think you should be doing, staying productive, etc., but also that you find interesting, that you find intellectually challenging and important. I think it's fine if people do that. My strategy hasn't been that. I feel that, my passion, my work is in physical activity and spatial epidemiology. That's what I've tried to continue to do. So it has been challenging to see, that it feels like the world has forgotten about all the other health-related issues we face, including a physical inactivity pandemic. Of course, those of us that are privileged, and I do want to stress this because a lot of people lost their jobs, have very difficult situations going on beyond having to work from home and beyond the social isolation that brings. But those of us that are privileged have now spent over a year working from home with all the challenges that brings, dealing with pets, dealing with children. I was also pregnant during the pandemic with my first child, so it was new for me. My baby was born in September. Pretty much no one at work saw me pregnant. It was very strange. And then, went into maternity leave during the pandemic, emerged from it during the pandemic. So same sort of, all the challenges that Kelly talked about really resonated with me. But today I want to talk about some of the opportunities to advance physical activity research, as well as networking, which during our career stage as early career investigators, and I know that also has a range of what an early career investigator is. I am, I guess, on the later phases of an early career person, but I still consider myself that as assistant professor and not tenured yet. I still consider myself part of the team or the group. And I think networking is so important. And even though we have these online resources like what we're doing right now, webinars, it has been a really difficult time to not be able to attend conferences, to see our colleagues on a daily basis, because we're in a phase in our careers where we're still trying to build and establish our network. So acknowledging that has been difficult. I think someone opened their mic. Thank you. So I'd like to talk today about a network that myself and some colleagues put together, the International Network for COVID-19 and Physical Activity Research, just as an example, not as something that's going to solve everybody's problems, but as an example of how we try to make the best out of a very, very bad situation that we're all going through globally. So to get there, how did the network even become a thing? Really, this all started with Dr. Jim Salas, which I think a lot of you know personally, and I think everybody knows who he is, who Jim Salas is. He reached out to the three of us, to Deepti, Adewale, and myself. The three of us are early career investigators from different parts of the world, because he was thinking of, I want to write a paper, a commentary, an opinion paper, something, to set forth a public health agenda tying COVID-19 with physical activity, not just as a way to be opportunistic and to pretty much find a way to do relevant physical activity research, which I think is important for all of us, especially in our early stages. We want to stay relevant. We want to do work that speaks to the current public health problems of the world while having our identity as physical activity investigators, right? But also, as a true way to inform public health action, because we still have a physical inactivity pandemic in spite of COVID, or on top of COVID. So, the idea of this paper, which is now published, by the way, and I invite you guys to read it in case you find it helpful. The idea of this paper, which was published in a special issue of the Journal of Sport and Health Science on physical activity during COVID, so there's a lot of really great papers there, was sort of to highlight that we know that physical activity has a lot of benefits for immune function, inflammation, antioxidants, and stress. And all of this really directly relates to the situation that's going on with COVID-19. Pandemic responses in different parts of the world, especially early responses, but we still see them today in many parts of the world, have included measures that restrict access to both indoor and outdoor opportunities to be active. And this has, as we know now, before we were saying likely, now we know we have a lot of data from different countries and parts of the world that physical activity has declined overall. Even if we have really nice examples and uplifting examples of how people are now walking more around their neighborhoods or using their parks more, or these sorts of things, one, there's some restrictions in a lot of parts of the world for not doing that. So even if we see some of those examples from some high-income countries, it's really not reflective of the reality of the world, given the restrictions. And two, I think we now have a lot of evidence that shows us that those of us that have access to do that, to spend more time outdoors and explore neighborhoods and parks and trails and those sorts of things, are again that group that is quote unquote privileged during the pandemic, that we've maintained our jobs or our regular standards of living and can do that, can spend the time doing that. Overall, though, we've seen declines in physical activity levels overall across all age groups and populations. Even though physical activity is usually considered an essential activity during other sort of types of shutdowns, we have seen very limited evidence to date of actual concrete efforts that try to educate people about the benefits of physical activity during COVID-19. And I know that I'm speaking to a group that's probably leading some of these efforts, so I'm not trying to say like, oh, nothing is being done, some is being done. But when you turn to look at government action, at what policy is happening from the public health side in terms of COVID-19, there's very little out there when you look globally. Across different countries of the world, there's very little focus on healthy lifestyles during COVID-19. And I do think, we wrote this paper during the earlier stages of the pandemic. There has been more work being done in this direction, but I do think, again, thinking globally, not just within our own setting, but globally, there's way more to be done for this. And we need to remember that even though vaccine rollout is now happening in some parts of the world, in the majority of the world, especially low and middle income countries, it's happening very, very slowly or hasn't even started at all. So the timeline and the length of this pandemic, when we think of it globally, is not really, the end is not yet in sight for a lot of parts of the world. So I think we need to remember that all of the things I'm talking about in terms of keeping people active or promoting activity during the pandemic are still very much relevant today. So the argument that we're making in this paper is that building evidence on the relevance of physical activity for COVID-19 could actually lead to setting higher priorities for promotion of physical activity during the pandemic, or that's our hope at least. So we believe that there's an urgent need to promote physical activity, to study physical activity during COVID, because a potentially powerful remedy or at least mitigation strategy for the pandemic, both the direct effects on actual COVID cases, as well as the indirect effects of health deterioration due to inactivity during the pandemic, is being ignored right now. Our author team has diverse skills, training, personal and geographic backgrounds and interests, while all of us being sort of joined together by our interest in physical activity and really by Jim Salas calling on us. So something relevant to early career investigators, and Kelly again touched a lot on this, is the importance of having good mentors and good advocates, senior investigators, these rock stars in our field that can actually try to bring us together, especially during a time like COVID, where Jim knew, and he told us this was intentional, that he invited 3 early career investigators. All of us have backgrounds of being from developing countries. I am now based in the US, and Deepti is now based in the UK, and this, you could call us brain drain, and that would be correct, because our countries don't have enough opportunities for us to establish research careers as we would hope for, but we still do work relevant for our countries. But we all, as early career investigators, Jim assumed correctly that we were struggling with finding opportunities to do relevant physical activity work during this time, to stay motivated, to stay productive, to find grants, these sorts of things. So having good mentors that sort of include you in anything that's important at a time like this, especially, and keeps you going and feeling productive and contributing something, I think is so important. So on behalf of my colleagues, my early career colleagues on this paper, we all thank Jim for the opportunity to be a part of this agenda setting paper. So what does the paper propose? We use the behavioral epidemiology framework, which has 5 phases, and adapted it for identifying research priorities for COVID-19 and physical activity research. So briefly, the behavioral epidemiology framework proposes that any health behavior should be studied in sort of 5 phases. The first phase is to establish the links between the health behavior and health outcomes in general. So we adapted this to COVID to establish links between physical activity and COVID-19. The second phase deals with developing measures to measure the health behavior at hand. The third phase deals with identifying factors that influence that health behavior, so that then it can be used in the fourth phase for developing hopefully efficacious interventions, developing and testing interventions to promote the behavior. And the final phase deals with research translation for public health impact. So as you can see here, we adapted each of these phases to be about physical activity as it relates to COVID-19. And in the paper, what we do is we propose for each phase broad types of studies that could fit within each of these phases. So we propose seven types of studies, as shown here on this slide, that fit into phases 1, 3, and 4 of the behavioral epidemiology framework right here. I'm not going to read them all, but you have them here on the slide. And we do acknowledge in the paper that we are not proposing specific types of studies for phase 2 or for phase 5 for different reasons. For phase 5, we're not really ready. We don't have efficacy and effectiveness demonstration yet, but we do propose the use of hybrid studies for this. And for phase 2, we didn't want to go into how you would adapt instruments for measuring physical activity during COVID, although we acknowledge that's a really important thing to do when you're conducting phase 3 and phase 4 studies. So what did we conclude in terms of our proposed research agenda? That there are many, the studies that we identified, and we identified 7 types of studies, and then within the 7 types, we proposed, examples of studies that could fall under all of those 7 types of studies. But we want to make it clear that these 7 research priorities that we identified are, the opinion of the 4 of us, and they are only a few of many important and feasible studies on the role of physical activity in the context of COVID-19. We also know that actually getting these studies funded and implemented will come with a lot of challenges during COVID-19, as Kelly was discussing. Data collection is not the same, etc. So thinking of online options, of mail-based options, of other things that could help address these limitations will be important. But we do think that conducting the prioritized studies could help to determine the appropriate priority of physical activity promotion in controlling stress, reducing the severity and or the recovery time among COVID-19 cases. And we are very thrilled to know that some of these studies for bullet point 1 are actually ongoing, and we will see results published shortly. So that was really exciting for us to see. And they did start after we published this paper, and there was some communication with us in terms of the people that are running these studies for us to help them design the study. So that was really exciting. We do think that the studies will also help in making decisions about managing indoor and outdoor opportunities for activity during the different phases of the pandemic, which includes this post-pandemic period that's not yet back to normality. If that will ever happen, it's something different. And hopefully these types of studies can guide the development of effective physical activity promotion strategies for various population groups, especially disadvantaged population during this pandemic, but also during future times of crisis, thinking of things like climate change, natural disasters, anything that can disrupt our reality as we know it. So we think this was a learning moment. We also, this is not published in the paper, but thought about it later, and we want to talk about that too. We think that there is another opportunity for research in terms of, we know that physical activity has shown to improve the immunity response to other vaccines, like the influenza virus vaccine, among older adults specifically. So we believe that there's potential for research here to see if physical activity can help increase immunity response among people that get a COVID-19 vaccine. So that's another potential idea for research. And we close the paper by introducing this global network, the International Network of Coronavirus and Physical Activity Research. What this is this is currently an online repository that is helping connect investigators from across the world that are either currently conducting studies on COVID-19 on physical activity, or that want to conduct studies on COVID-19 and physical activity research, and are looking for collaborators, are looking for funding opportunities, are looking for the right measures to use for ideas. So I have 2 links here. Feel free to use them if you have a study, either a funded study, a study that is ongoing, or you have an idea for a study that you want to register. This is the submission form. And in the second link, you can actually access and see the registered studies from around the world. We have studies right now, I think from 8 different countries, 3 different continents, ongoing studies that are registered in the repository. And we do know that people have been connecting with each other, which is fantastic, because we want this to be a good networking opportunity. So with that, I guess our conclusion from this is that when life gives you lemons, you can make lemonade, even if we know times are very, very tough. And of course, stay active while doing that. Thank you again for the opportunity to talk to you today.
Fantastic. Thank you ever so much, Deborah. Really, really interesting. I'm going to jump straight to the audience and ask if anybody has any questions for either Deborah or Kelly. I'm just conscious of time. And I have lots of questions that I could ask, but I want to open it up to the floor. So if anybody has any questions, feel free to unmute yourself and ask.
I think, Anna, there was one in the chat from Sharith asking about different areas that we can go to see the data. And I think that might be the databases that you were just showing, though, Deborah. Am I correct?
Yes, so with the links, and let me see if I can paste them here in the chat, if you didn't have a chance to like take a screenshot of what I just presented. You can see the studies that are going on. Now, in terms of their actual data, you would have to reach out to each investigator. And we do have in the repository the contact information for each study that's either a study idea or ongoing study. And I know I have a couple of my studies registered, and no, I wasn't like ultra good at getting funding in COVID year or whatever. So I do want to disclose that these are studies that I was like, I'm going to start online surveys because I'm interested in seeing what's going on, especially with Mexican populations, since I'm from Mexico, and Latin America, Latino populations here in the US. So I ran some online surveys with no budget. And I have gotten, I registered that in our repository and have gotten emails from 3 colleagues from around the world that are interested in helping and becoming involved with the publications, helping with data analysis. And that's great, because I'm getting help and new collaborations and meeting fun people to work with.
Thank you. Thank you.
Luca, I noticed you're unmuted. Did you want to ask a question? So I guess I'll jump in then, Deborah. So obviously, I think, you know, early career professionals potentially are at the highest risk to experience a negative impact from the pandemic and from COVID-19. And disruption to research presents itself in lots of different ways. But I'm interested in particular if, and this is probably it's a big question, but what can we in high income countries do to support those researchers, perhaps in lower middle income countries, in terms of physical activity research?
Thank you. That's an excellent question. I don't know that this necessarily is something that somebody here has the power to do, but we can advocate for it. Funding, opportunities to support work, and sometimes it can be in a way that it's a win-win for the high income country and the low and middle income countries, but opportunities for global research on these topics, on staying active during the pandemic, strategies to reduce inequalities and opportunities for activity during the pandemic, because the lockdown has been very different for people of lower SES levels, disadvantaged populations, and in different parts of the world. So advocating for any type of funding opportunity, even if it's small pilot funds to do this, is one thing. I think the second one is, and I really appreciate it, for instance, Jim invited me to this paper. Another one of my mentors, Michael Pratt, invited me to another sort of commentary type paper on, it wasn't COVID related, it was just on need for more policy action in the global South for physical activity. And just anybody that has the opportunity, whether you're in a high income country or not, to invite your colleagues that are in earlier career stages and probably struggling a lot to stay productive during the pandemic, to papers, to help with data analysis, to get involved with projects that you may have going on, especially given that I'm sure that their work, the early career investigators, is being disrupted in many ways, is very, very welcome. I was very worried about not having first author publications, even submissions. Like, I just couldn't find the time. I was pregnant, then I had a baby, then there was COVID. I had ongoing studies that had just been funded the year before and was feeling very good about myself. And then the data collection had to stop for all of them, for 3 major studies. We had to furlough staff that I had hired, and it was my first time hiring staff, and now I have to furlough them. I felt awful. So just anything that allows us to to have CV items that show that we're doing some work and some contributions to our field. It was really, really welcome for me to be on this paper, on the other commentary paper that was sort of agenda setting papers. So things that are low hanging fruit for more senior colleagues or people in high income countries. And for us, it was like, oh, thank goodness I can show some work this year. Yeah.
Great, thank you.
I think Claire has her hand up. If you want to come in, Claire, feel free.
Yeah, so firstly, thank you, Kelly. That was really refreshing. I don't think I've ever heard a talk in kind of our field as honest as that. So thank you. I really, really enjoyed it. I was the same as you, also came off maternity leave, came into the pandemic, straight into home working. So there was a lot of overthinking and, you know, what's this year going to bring? But just a question, I guess, for both, or do you think there's many, I know you said about papers, but other chances to network? It's obviously we're on a webinar like this, but to kind of get to know others, because obviously, well, active living, I'm going to it next week, but not. And it's my favorite conference. I absolutely love it. But it's just that you won't have the social, the network, kind of the discussions over, you know, lunch that you would have. Is there anything else we could do? I don't, you know, to get to know people and meet others?
Do you want to take it, Deborah?
I was gonna like I don't know, honestly. That's a tough one. I'm part of that board for ALR and or ALC now, Active Living Conference. And we have been brainstorming of how to do this, the networking opportunities even within the conference. We'll have some sessions that are going to be like this, that are going to be no presentations and just get to know each other. I'm organizing a conference in Latin America too that was supposed to happen last year. That was one of my biggest disappointments because I put so much effort into like throwing a conference as an early career investigator, taking that on for Latin America that doesn't have like a society for physical activity. And then it was happening in April of last year and we had to cancel it a month before after 3 years of planning. So we're having it this year online and we are going through the same, like, how do we get people to network and know each other? I don't have a good answer other than if in your own city, there are people in similar career stages as yours that you know that they're starting a program or starting doing something that's similar to your career stage and reaching out and actually doing things outdoors, socially distancing, just for fun, not necessarily to talk too much about work, because I think that's how great work and relationship starts, is first get to know the person. I think that would be good. I have my experiences at the Zoom thing for these informal sort of let's have lunch together things. I don't think it works that well. I'm not trying to be discouraging. I think when there's a congress online that has the session, you know, attend the session. But the natural element of interaction is really difficult to replicate. Sorry to be a little bit of a party pooper, but I don't know if Kelly has any ideas.
It can be awkward. Yeah, it can. I agree.
I suppose the only things I can think of, this was more with kind of a training sessions and things that I've been on, but they've used the sort of breakout room function, and that has actually, you know, you might be in groups of 3 or 4, and that does tend to work relatively well, but obviously you're not organizing these conferences, so but you know, if you do have any mechanisms for kind of giving suggestions, and that might be a way of doing it, because I think in a large group setting, doing something virtually, yeah, that it's just awkward. I've also experienced it, and it's kind of cringy. But I suppose the only other thing I could think of was social media. I mean, I suppose encouraging, you know, at these conferences, there's always kind of a Twitter handle or a hashtag that's being used. So maybe searching for people that are using the Twitter handle or the hashtag, and you know, see what people are saying, and then maybe use that as a mechanism for linking in with people who are talking about similar things that you know that you're interested in. But yeah, it's not ideal, and it doesn't replace it. But I suppose it's just trying to find ways of maybe bridging the gap until we can all kind of be in the same room again together.
Thank you. Thanks.
All right. I know we've got so much we could talk about, but I know I want to be mindful of everyone's time. Thank you so much to Kelly and Deborah. That was amazing. I just think it's just so nice to have a really open discussion about some of the personal challenges, as opposed to thinking that we're all just like these robots that spit out papers. So really appreciate that insight. Just before we go, we do have one webinar to announce, which is on April 7th. It's a Wednesday, and it's from 9:30 to 10:30 UK time. And it's called Using the International Children's Axonometry Database to better understand PA and health in young people. So if you would like to get on a webinar, just let us know. And it's on our Twitter page, it's on our email list serve as well. And then we also have a survey that we'd like you to complete as a post-webinar evaluation if you guys can. But if you have any questions or any further thoughts as to how both HEPA and ISPAH can better facilitate networking based on the questions that we've had today, that's a really big priority for us, is to not just wait until the conference to host these kinds of events. And we would really like to have us be a space where early career network professionals can come and present their data as well. And so we're really trying to work on making more of those opportunities and being more intentional. So without further ado, unless Joey or Anna has anything else to add, we can let you all go. But Joey, Anna, you good?
Yeah, no, that's perfect. Thanks everybody for
good.
attending, and thanks again to our speakers.
Thank you
thank
guys
you,
so
everyone.
much.
Thank you for having us.
Take care. See you later.
Bye.
Thank you. Bye.
Stop the recording now.